A pleasant day to everyone. I am Eliza Janina Iuson, and today I am with Miss Isabel de la Cruz to present our discussion about gestational diabetes mellitus. First, we have the presentation outline to have an overview on the list of topics that will be tackled. As we have studied in our previous lessons, we learned that there are some common maternal health conditions or problems a woman may experience during pregnancy. One of these is gestational diabetes mellitus or GDM, which is a condition in which a hormone made by the placenta prevents the body from using insulin effectively. Glucose builds up in the blood instead of being absorbed by the cells. Some women have more than one pregnancy affected by gestational diabetes. GDM usually shows up in the middle of pregnancy, and doctors most often test for it between 24 and 28 weeks of pregnancy. So, as I have mentioned nga, GDM typically appears during the second or third trimester, kaya tinatawag na gestational. And also, it tends to disappear after the birth of the baby. Moving on to its types and classifications, basically GDM has two types, type A1 and type A2. So first, for the type A1, abnormal glucose tolerance test or OGTT, but normal blood glucose levels during fasting and 1 to 2 hours after meals. So for this type, diet modification is sufficient to control glucose levels. On the other hand, type 2, abnormal OGTT compounded by abnormal glucose levels during fasting and or after meals. In this case, additional therapy with insulin or other medications is required. So from this, we can infer that type A1 is milder and easier to manage since alteration in the client's diet is sufficient to control glucose levels, unlike sa type 2 na mandatory yung additional therapy with insulin or other medications. Next, for the anatomy and physiology, as you can see in the picture, the pancreas is a long slender organ, most of which is located posterior to the bottom half of the stomach. It has both exocrine and endocrine functions. Its pancreatic islets are the cluster of cells that secrete the hormones glucagon, insulin, somatostatin, and pancreatic polypeptide. Alpha cells of the pancreas produce glucagon while beta cells produce insulin. Insulin and glucagon are involved in the regulation of glucose metabolism. Insulin is produced by the beta cells in response to high blood glucose levels. It enhances glucose uptake and utilization by target cells, as well as the storage of excess glucose for later use. The hormone glucagon is produced and secreted by the alpha cells of the pancreas in response to low blood glucose levels. Glucagon stimulates mechanisms that increase blood glucose levels, such as the catabolism of glycogen into glucose. Next, let us discuss the pathophysiology of GDM in a concise manner. Based on the diagram, some of the risk factors were stated. In here, we used mnemonics for better understanding and remembering. So for the risk factors, we have MAMA or MOMMA. This includes maternal age over 25, overweight or obese, macrosomia or previous large baby, multiple pregnancies or yung maraming beses nang nanganak, and lastly, a history of GDM. These factors greatly increase the risk of pregnancy-induced glucose intolerance. Likewise, there are normal metabolic changes that takes place during pregnancy. First, the fetal demands are increased after 18 weeks gestation. This means na 80% ng energy na kailangan ni fetus ay nanggagaling sa maternal glucose. When this happens, nag-i-increase din yung carbohydrate intake to keep up with the demands, which will eventually lead to increased insulin requirements. So since tumataas yung demands, si pancreatic beta cells ay kailangang mag-work ng mas matagal to keep up. And then another metabolic change during pregnancy is the placental counter-regulatory hormone na pinipigilan yung action ng insulin. So if hindi magagamit effectively si insulin, the tendency is nagbe-build up siya and therefore nag-i-increase yung insulin resistance, which means na sila liver, muscle, and adipose tissues become less responsive to insulin. And then again, when this happens, the beta cells need to work overtime to match with the increasing insulin demands. So this changes greatly affects the pancreatic beta cells since eventually, these cells will tire out or mapapagod na sila. And then when that happens, they will be unable to keep up with the insulin demands, kaya tumataas yung blood glucose levels kasi nga nag-accumulate na doon. And then dito na pumapasok si GDM. Next, GDM may present any obvious signs or symptoms, as many of the changes can be similar to those that occur during pregnancy. However, possible signs and symptoms include the following. So for this part, meron ulit tayong mnemonics na 4 P's for us to remember it easily. So for the first P, we have polyuria, wherein the client urinates more than usual and passes excessive amounts of urine. Polyphagia, the extreme or excessive hunger or increased appetite. Next one is paresthesia. So dito naman merong abnormal sensation of the skin such as tingling, pricking, chilling, burning, numbness or yung namamanhid with no apparent physical cause. Lastly, we have polydipsia, or the feeling of extreme thirstiness. Any woman experiencing new or unusual symptoms during pregnancy should speak to her doctor, since the doctor may be able to determine whether she has developed gestational diabetes or any other condition. Next, for the diagnostic test, a doctor may diagnose GDM during a routine health check. So typically, they will ask a pregnant woman how she is feeling and request a urine sample. If a significant amount of sugar is present in the urine, they may conduct a screening for GDM. As I have mentioned previously nga, most pregnant women will receive a screening test for this disorder between 24 and 28 weeks into the pregnancy. Moreover, women who have a higher risk of developing GDM may need to undergo more frequent testing. So, included dito yung mnemonics natin na mama sa risk factors. Although, meron pang ibang factors, pero yan kasi yung mga most common. So, for the first screening test, 1-hour oral glucose tolerance test at 24 to 28 weeks. In this test, a healthcare professional will draw your blood 1 hour after you drink 50 grams of glucose solution. You do not need to fast for this test. Fasting means having nothing to eat or drink except water. If your blood glucose is too high, like nasa 140 milligrams per deciliter or more, you may need to return for an oral glucose tolerance test while fasting. If your blood glucose is 200 or more, you may have type 2 diabetes. So, if yung result sa 1-hour OGTT is abnormal, the 3-hour OGTT will be administered on another day. This will measure blood glucose after you fast for at least 8 hours. First, a healthcare professional will draw your blood, and then you will drink 100 grams glucose solution. You will need your blood drawn at the following times: 1, 2, and 3 hours for a doctor to diagnose gestational diabetes mellitus. High blood glucose levels at any 2 or more blood test times mean you have gestational diabetes. It is presented naman sa slide yung mga oras and values to determine if nasa normal range ba yung kay client. So, ang responsible na sa pag-explain and interpret ng OGTT results is your healthcare provider.
For the medical management, we make use the word sugar babe as a mnemonic. S for screening. Na-discuss na kanina yung mga different diagnostic tests used to screen if yung pregnant mother ba is merong GDM. Next is letter U, that stands for use diet and exercise for managing blood glucose levels. Some pregnant mothers may need medication such as metformin or insulin injections. Yung diet is nakakatulong siya para ma-manage yung blood glucose levels because primarily yung glucose nanggagaling siya sa mga kinakain natin. So we have to make use of appropriate diet to maintain normal blood glucose levels. Next is the exercise. For exercise, yung glucose na present sa blood natin is natatransform siya into energy pag nag-exercise. So, hindi siya na-stock up lang sa blood, thus maintaining its normal level. Next is letter G, stands for glucose monitoring on daily basis. If may GDM yung mother, kailangan niya i-monitor yung glucose niya on a daily basis for 4 or more times a day using, for example, a finger prick test and a glucose meter. Make sure that the pregnant mother do this first thing in the morning after she wakes up and before and after meals. Next is A, which stands for assess urine for glucose during prenatal visit. We need to assess if there is a presence of glucose in the urine because this indicates urinary tract infection. We may ask the mother if she feels burning sensation while urinating, as this indicates infection. For our risk factors for GDM should be assessed during prenatal visit. So, kailangan i-assess natin if yung pregnant mother is meron ba siyang present ng mga risk factors for GDM para hanggat maaga pa is ma-prevent na yung pag-develop nito. Next, letter B stands for blood glucose swings during and after labor. During and after labor, the mother can experience blood glucose swings, so we have to monitor it. Primarily, we have to maintain euglycemia or the normal blood glucose level. This is to decrease the risk of the baby acquiring hypoglycemia at birth. Paano ba nangyayari yung hypoglycemia sa baby? Since yung mother na may GDM, mataas yung blood glucose level niya, napapas ito hanggang sa fetal circulation and then na-acquire ito ng baby. So, ang magiging response nito is yung pancreas ng baby, magpuproduce siya ng insulin to counteract the blood glucose level. Kaya lang, pag na-deliver na yung baby, magsa-stop or mawawalan siya ng source ng glucose, which is yung mother. Pero may insulin pa rin siya. Kaya nagkakaroon ng hypoglycemia. Next is during labor, administer IV glucose or insulin to keep their glucose level within normal range. So, kailangan mag-administer ng IV glucose or insulin to compensate if merong increase or decrease sa glucose or insulin. Next, after birth, monitor both the mother and baby for hypoglycemia. Mamamonitor natin yung mother for hypoglycemia through assessing for signs and symptoms such as sweaty, cold, and clammy skin. Sa baby naman, pwede siyang at risk siya for respiratory distress syndrome since yung surfactant na apektuhan siya dahil sa presence ng glucose. Next is oxygenation may be required kasi nga pwede siyang magkaroon ng RTS. For letter A, which stands for adverse effects of GDM, should be closely monitored. So, ano ba yung mga complications ng GDM? First is the preeclampsia or hypertension. Maaring magkaroon ng preeclampsia or hypertension ang pregnant mother with GDM since yung glucose is pwedeng mag-cause ng narrowing ng blood vessels which can cause hypertension. Next is UTI or vaginal infections. Yung presence ng glucose sa urinary tract ng mother is nagpa-favor siya ng bacterial growth kaya nagkakaroon ng infection. Risk for C-section since yung baby maaari siyang mag-carry ng large baby since yung mataas yung glucose niya, pwedeng yung delivery niya is through C-section dahil hindi kakayanin ng normal delivery. Next is RTS for baby or the respiratory distress syndrome. Sabi ko nga kanina, ang surfactant naapektuhan yung pag-produce ng surfactant dahil sa abnormal levels ng glucose. Hypoglycemia after birth. For letter B, which stands for blood glucose monitoring postpartum, the doctor will check the blood sugar after delivery and again in 6 to 12 weeks. This is to make sure the blood glucose level ng mother is bumalik na sa normal state. Next is E, which stands for Educate the Mother about the importance of regular testing of diabetes. Every 3 years, test should be done. Kailangan ng test every 3 years kasi maraming studies na nagsasabi na about 50% of pregnant mother that had GDM is nagde-develop into type 2 diabetes. For the surgical management will be based on the complications caused by the GDM since walang specific na surgical management talaga para sa GDM. For example, kanina, isa sa mga pwedeng maging complication ay yung C-section. Nursing diagnosis and interventions. We came up with a nursing diagnosis that states unstable blood glucose level related to pregnancy as evidenced by increased urinary output. Yung increased urinary output kasi is signs and symptoms siya or kabilang siya dun sa 4 P's ng GDM. For the interventions, number 1, monitor blood glucose level on regular schedule through finger stick glucose testing. So sabi nga kanina sa medical management, kailangan i-monitor ng pregnant mother regularly yung glucose niya since yung unstable blood glucose is often associated with failure to perform testing on a regular schedule. Number 2, assess and record dietary pattern and caloric intake using a 24-hour goal. So, kailangan i-assess natin yung dietary pattern or yung diet ng mother para ma-evaluate natin yung client's understanding regarding her situation, kung nagko-comply pa siya sa mga kailangan niya gawin like the proper diet and exercise. Next is weigh the client every prenatal visit. Encourage the client to periodically monitor weight at home between visits. Since at risk yung mother for carrying a large baby because of her abnormal blood glucose level, kailangan wini-weigh siya lagi para ma-monitor natin kung beyond na ba weight gain niya sa appropriate weight. Weight gain serves as an indicator of determining caloric adjustments. Next is number 4, assess urine output for presence of sugar. So sabi ko nga kanina, yung presence ng glucose sa urine is maaaring mag-indicate ng urinary tract infection. That's why kailangan laging i-assess. Number 5, teach the client about proper diet and exercise. So proper diet and exercise helps the mother in maintaining her blood glucose levels. Next is number 6, lastly, consult with nutrition. Next is the medications. For the medications, you have metformin. Dosage, initially 500 mg twice a day or 850 mg with meals. So, ini-increase gradually yung dosage niya pag yung blood glucose level niya is hindi pa rin bumababa. Pero may maximum lang siya ng 2,550 mg. Next is yung route per orem or orally. For the indication, yung metformin, pinabababa niya yung serum glucose by inhibiting hepatic gluconeogenesis and glucose absorption. And ini-stimulate niya yung pag-uptake ng cells ng glucose. Nakakatulong din siya sa pag-reduce ng weight gain. And then, yung metformin is na-reduce niya yung insulin resistance and yung effect na hypoglycemia since hindi niya ini-stimulate yung B cell na found sa pancreas na mag-produce ng insulin. However, unlike insulin, metformin does cross the placental barrier. So, ibig sabihin, maaaring maka-apekto ito dun sa baby. Kaya lang, marami namang studies na nagsasabi na wala tong negative effect dun sa baby. For the nursing consideration, first is we have to determine the vital signs. Pag na-determine natin yung vital signs, ito yung magsisilbing baseline data natin. Since yung gamot or yung oral anti-diabetics is nakaka-increase siya ng cardiac function and oxygen consumption which can lead to cardiac dysrhythmias. Number 2, administer oral anti-diabetics with food to minimize gastric upset. So, pag iinom siya ng metformin, kailangan laging may laman na yung tiyan niya. Then, after meals niya iinumin para hindi sumakit or ma-minimize yung pagsakit ng tiyan niya. Number 3, monitor blood glucose levels and report changes. Reference value is the 60 to 100 mg per deciliter for blood glucose and 70 to 110 mg per deciliter for serum glucose. So, kailangan minom na ng gamot yung pregnant mother, kailangan i-monitor yung blood glucose level para malaman kung kailan mag-a-adjust ng dosage. Number 4 is prepare a teaching plan based on the patient's knowledge of health problems, diet, and drug therapy. For the prevention, the mother should consume healthy foods and have a good diet. Since sabi ko kanina, yung glucose is mainly nakukuha natin siya sa kinakain natin. So, kailangan yung pregnant mother, alam niya kung ano yung mga appropriate meals, appropriate diet na kailangan niya. Next is keep active. Exercising before and during pregnancy can help protect the mother from developing gestational diabetes since yung glucose is nabiburn or nata-transform into energy and hindi siya nasa-stock sa blood. Next is start pregnancy at a healthy weight. A woman is planning to get pregnant, kailangan normal yung BMI niya para decrease yung risk in having GTM. Next is don't gain more weight than recommended. Gaining too much weight too quickly can up the risk of gestational diabetes. Educate the client of what is the reasonable amount of weight gain is appropriate.